All right, well, good morning, everyone. Welcome to this month's edition to What's Your Plan? My name is Steve Lorberbaum. I'm the owner of Assisting Hands Home Care, and I work with Patricia, who is our Director of Community Relations, right? Okay, thank you. Patricia has so many different hats and titles, I can never keep them straight. So in any event, Assisting Hands Home Care, we're all about educating people to help them make informed choices about aging in place, and in particular with caring for their loved ones. So we work with people, we're a private duty home care company, so we will put aides matched up with people to make sure they can be safe wherever they're calling home at the moment. It could be a hospital, a hotel, a private home, an assisted living community, a rehab community. We match aides with people to provide them with a little extra support, whatever it is they may need. And part of our plan and mission is to help educate people about what's available, what's out there, how to plan and prepare. And with that, we have a great person today, Arvette Reid, who's going to help us with a life affordability plan. So she's going to help us figure out how do we do it, because no one is given an expiration date. If we knew the last day we were beyond the planet, life would be easy to plan for, because you know how to spend every last dollar up until that moment. Unfortunately, or fortunately, we don't know. So we need to plan and prepare, and we need advice from people like Arvette. So Arvette, introduce yourself, give us a little rundown on you.
Hi, yeah, so there's a full of bullets for you to take a look at. So I'm born and raised in Alexandria, local person, but I've worked all over the country with clients. I spent 15 years actually working in the senior housing and healthcare industry, always marketing to missions, working directly with families. So I did independent living, assisted living, dementia care, nursing care, and hospice, large communities like big continuing care retirement communities, and some standalone communities as well. And during that time, I was always the person asking for the check, right? That was my job. So 5 years ago, I joined the wealth management firm with the sole purpose of figuring out how to better help families plan for healthcare costs. And so what's interesting, though, is 2 months after I started this new job, my mom got sick and ended up dying 18 months later. And then also during that time, within the year, my father-in-law moved from this big, like 2-acre property, to Green Spring, which is an Erickson community here in Northern Virginia. So I tell people, when I talk to families, not only do I look at it through the lens of a senior housing and healthcare professional, right? I also look through it the lens of a finance professional, but more importantly, I look at it through the lens of an adult daughter. So I like the fact that I can get on podcasts like this and just share my story and share my knowledge. So thank you again, Steve and Patricia, for inviting me.
Great. So how did you get from the world of electrical engineering to senior care? Because
I know that is always like the great question.
Right.
So my big brother went to school for electrical engineering. And so I was like, ooh, this is great. So I did get an electrical engineering degree from University of Virginia. I'm very proud of that. And spent 10 years working in software, became a global marketing manager, and loved what I did and launched services worldwide. And I just kind of got burnt out. And after spending so much time growing up in Alexandria at Goodwin House, which is one of the continuing care retirement communities, we always knew people that lived there. I just decided like I needed a change. And so I got a job at Goodwin House in the marketing department. And that's what started my 15 years of senior housing and healthcare. And now I'm in my third industry of finance. But what's interesting is they all like tie together. And what I learned in software about building programs and processes is exactly what we've done in building the life care affordability plan where I am now. So my worlds of software and healthcare came together in finance.
Gotcha. All right, so tell me, what is a life affordability plan?
Yeah, so the life care affordability plan is a healthcare driven financial plan. So let's talk a little bit about that. If you have a financial professional in your life right now, and not everybody does, but that financial professional could be the person at the bank that you're talking to about CDs. It could be where your money is housed, like a Charles Schwab or Fidelity, or it could be you have a wealth manager that you meet with more frequently. It doesn't matter. But most of the financial professionals are talking to you about your pre-retirement goals, which is like, saving for college for a child, house modifications, or they're talking about when you retire, where do you want to be? What do you want to spend on, right? And then your legacy goals, your documents, when you die, where does your money go? But all of us in the senior housing and healthcare industry, and Steve, I still consider myself part of that industry, we all know that the healthcare stuff happens right somewhere between retirement and death. And nobody's really told you how much all that stuff is going to cost. And most people think it's covered by Medicare or insurance. So what happens is people like Assisting Hands have to deliver the bad news to the clients like, no, I'm sorry, this is a private pay service only, right? So it's a big shocker to families. So what we did with the Life Care Affordability Plan is figure out a way to help families build out healthcare scenarios so that we can show them how their finances tie to each scenario. And it helps reduce the anxiety about how you're going to pay for these services, either now because you're in an emergency mode, or if you're a planner and you just want to know what's coming down the line.
Okay, so does that include talking to people about long-term care insurance or disability insurance or both?
Yeah, great question. All of the above. So most financial professionals want you to transfer your assets over as asset under management. So give me your money and I'll manage it. That's not what we're talking about. We're talking about a flat rate one-time plan where we look at everything financial adjacent. So long-term care insurance, we're going to look at life insurance policies. We're going to look at, survivor benefits, for example, for a couple. So say you have a couple that living at home and the gentleman worked all his life and he's the one that's sick and is getting, 12 hours a day of help, right, from you guys. The key is what happens when he dies? How much of the survivor benefit is she going to get? Those are the level of details that we go into with every single plan that we work with clients, because that's what gives them a sense of calm about what really their options are in the future.
Gotcha. So would you also work with families with children with, adult children with disabilities?
Yes, we do have some people we've done special needs in the special needs space with, some attorneys we work very tightly with, and they call us to help with that. Usually in that space, those trusts, the attorneys are doing the trust and have everything set up. Where we come into play, and I have a great example of a client we work with. The parents were getting older. They had everything they needed set up for their adult special needs daughter. They knew they were getting older and they started to need help, and they were concerned about spending money on themselves because they were afraid that their daughter wasn't going to have enough. So the plan that we did was really to help them see how they could get the help they needed now and still make sure that their daughter was going to be taken care of for years to come.
Okay, so if I, let's say, got a diagnosis of Parkinson's.
Yep.
Would I be able to then come to you and say, okay, so I have Parkinson's. What's that going to look like in terms of care for me and where I go and what I do? And you all have a specialty of understanding Parkinson's and disease progression and can help plan for that? Is that how it works?
Yeah, you know what? That is spot on. And it's not just me. I tell everybody there's a three-legged stool to any plan. There needs to be the legal aspect, which everybody talks about their documents. There needs to be the financial aspect, which is where we come into play. But there also needs a care plan of some sort. So in some cases, people already have a care manager or aging life care professional. Sometimes they're already living in a community, or sometimes they already are one of your clients, and you guys can give us the input we need to put it in. So part of the discussion is, right, you're spot on. It's not just about what you need now. It's about what you're going to need 5 years from now, 10 years from now. And how do we make sure that we put real cost into these plans? We're not pulling from actuarial table or some average from around the country. If you live in Maryland, then we're going to look at the prices in Maryland. If you live on the Eastern Shore, for example, versus Bethesda, things may be different. So we can use actual pricing based on wherever the care need is.
Gotcha. Okay. And so how does someone get started? Like, how do they find you? And then, what do they have to pull together to make it a useful process?
Oh, wow. Great question. So anybody can talk to me for free. The experience of getting to know me is very similar to a senior housing and healthcare experience. And those of us that work in the industry, we are super tight. We refer to each other all the time. We bounce ideas off of each other all the time. So it's just like that. And when I meet with clients, sometimes they're not the right fit for us. And then I'll continue to connect them with other resources within the industry. But if they are the right fit for us, then I'm going to give them a list of stuff that they have to gather. Sometimes it's very overwhelming, but the only way to do this correctly is to touch point on everything. So for example, grab a couple statements from your credit cards if you have them. Give us a couple of years of tax returns so we can see what's happening on your tax returns. So it's not just about investments. Earlier, I mentioned life insurance policy, because sometimes there's a way to pull money early out of a life insurance policy if you need care, right? Not everybody has long-term care insurance. So the goal of this process is to put all the pieces together of the puzzle. When you are paying for care, it really is an income question, not an asset question. So most of the time when you first approach people, they're like, okay, what do you own your house? Do you have investments? The real question is, how much is your Social Security? How much is your pension? Do you have RMDs from IRAs? Do you have long-term care? You have to build the pieces of the puzzle to see where the gap is covering the cost of care. That's where all the analysis and the strategy comes from, the certified financial planners. Where do we get the gap to pay for the care for now? And let's project what you're going to need down the road, and then make sure we know where that's coming from.
Gotcha. So I have a friend who's a financial advisor, and one of his tagline statements is, the only thing worse than dying is outliving your money.
Yep.
And so along those lines, if you are a person that, unfortunately, you're going to outlive your money, and Medicaid is a likely option, is that something you all counsel on? Can you help with Medicaid spend down and Medicaid planning and advising, or is that not your world?
No, we do touch on that, and let me explain how. So you cannot say, I'm going to do Medicaid spend down without understanding your full financial picture. So we actually get attorneys where people go to them and say, I think I need to do a Medicaid spend down. And then they come to us first, and we do the full financial picture, because you can't talk about Medicaid spend down if you don't understand what the care plan is and how long people have a potential to live, right? It's all a swag. And then when we do the plan, we'll say, if you look at this with these assumptions that you're going to go from 4 hours a day of home care to 12 hours a day of home care to a live-in, right? That we need to make some assumptions and cost and timelines. And maybe in year 3 or year 4, you might want to revisit where you are, and that time reapproach the attorney, right? So we try to give people points along the way that they need to reevaluate, because you don't want to say, let's start Medicaid right now, too early. And then what if the person dies sooner than you thought? That's what happened in my case with my mom and dad. So my mom got sick. We went through this thing, like she really wanted to stay home. We always ask our clients what they're most hopeful for. So my mom was most hopeful to stay home. She was most fearful of going to a nursing home. What happened was we brought in home care. She started to decline even more. She ended up in the hospital, and we had to have that continued family discussion about, do we now need to do some Medicaid planning, because she wasn't walking and coming home just wasn't an option anymore. So, I've been through those tough conversations in my own family, and I know how to help guide others through some of those what ifs.
Gotcha. Okay. So I see on your list of topics, number 1 is have the talk. And I talk to people all the time about, what do your kids know about your plan to want to stay at home? And the usual answer is, well, they know. Well, like, did you tell them? No, they just know. They know me. And then I say to them, no, the last time they knew you was when they lived in this house when they were 18. They're now 65. You're 90. They don't know you.
Yeah.
Have the talk, but they don't listen. So how do you get people to understand that the talk is a really important thing to do?
Oh my God, Steve, I love that you just said. That is like right on point. So I am very big on family meetings. And one of the things when clients hire us, I tell them, like, This is not going to be your typical financial conversation where there's one person across from you talking numbers. We're doing the family thing. I'm an adult daughter, and when my parents are making decisions, I wanted input. So part of why this whole process is successful is because we give everybody the opportunity to be heard, but I'm also the first person to say, this is your parents' plan, not yours. You get an input. At the end of the day, I want everybody kind of on the same page. And the first plan I did when I joined was a family, 3 kids, 1 daughter, 2 boys, mom and dad getting older, dad getting dementia. And the daughter's like, everybody thinks I'm taking care of mom and dad, but me and my husband are talking about retiring in a couple of years to Florida, and nobody's paying attention. So when I did the family meeting and we did the plan, we went through all of that. And I asked her at the end, I said, what was the best part of this process for you? And she said, the best thing was the next time dad has a problem, we can all go to our binder, because all of our clients get a binder at the end. This is actually an example of it. She said, we could all go to tab 3 and say, this is what we agreed upon. So you really have to pull in the family into these conversations, or else nothing's ever really going to get accomplished.
All right. Now, if somebody says, because we've had it, well, I don't want my kids involved in my finances. Yeah. I don't want them to know what's going on. That's not the way it works in the world. Parents know what their kids are doing, but kids don't know what their parents are doing.
That's true.
So how do you sort of bridge that conversation, or can you still do work without the kids knowing the financial aspects of their parents' lives?
Yeah, so the process is usually 3 meetings. So sometimes in cases like that, exactly, we will start out with a family meeting just about hopes and fears and desires. Then I will work on the scenarios and the pure finances to each scenario, right, with the adults. And then we may wrap up with the children and talk about what we learned. So along the way, we can insert financial conversations or not. And I've actually had the opposite, where I had a woman at the beginning who said, I know I need my daughters to understand it, but I want to understand it first. So we went through the whole thing with her. And at the end, she pulled both her daughters were in college, and her husband had Alzheimer's. So she pulled her daughters in our office, and we went through finances A to Z with them, and they knew nothing. So we started from scratch and basically gave them a financial 101 education. And that really helped calm the mom, the parent down, because she knew if something happened to her, which I'm sure, Steve, have heard, the well spouse is always concerned, what if something happens to me? So this mother was like, if something happens to me, I know my daughters understand what the plan is.
Gotcha. All right. And so do you stick around, or are you like a one and done? I mean, how does it work?
So we built this as a one and done, and I'm going to tell you why. Because it's a $4,000 flat rate. I like to tell everybody that. And it doesn't matter if you're single or a couple. I do not charge by the hour. We usually go until we're done, right? We go until we're done. And it usually is about 3 months with lots of meetings and lots of homework. And the reason we do that is because that way we can keep the cost down. If this was an ongoing thing, finances change all the time. So if you come back to me, we have to redo all the numbers, right? So the idea is to give you, we put a lot of cushion in our planning. It's a very robust system. This is not Excel that we're talking about. We're talking about a very robust financial system that allows me to put customized scenarios, actual pricing. We can make death date assumptions. We can make care needs assumptions. There's all kinds of market fluctuation assumptions, all kinds of things we can do on this plan. And when we're done, it's very important that we give them next steps. We get, here are your next steps. Here are some resources for you going forward. But the number one thing people say that happens at the end of this is we've reduced their anxiety about what they're able to afford. The number one thing that the senior housing and healthcare industry professionals love is that I've teed everything up. So I tell these families, look, we have built in 24-hour care in this plan. So as your care needs increase over the next 2 years, 3 years, and assisted hands comes to you and says, we need to increase your hours, you don't need to push back because we've already showed you can afford it. So just say yes.
Gotcha. Okay. And is there a age range where it's like, this is the prime age group that people should come talk to you? Or is it across the continuum?
Across the continuum, and we've dealt with families who have diagnosis in their 40s, and then we dealt with families who are in their at like 95, and they're trying to decide if they're going to stay home or move, right? And all things in between. People come to us for in different reasons. One, sometimes it's a home versus move comparison. Sometimes it's a analysis of pricing, right? Like, I don't understand how this is going to work. Sometimes it's we just had to make an emergency decision, and now, oh my gosh, I don't know if I can continue to afford this, right? Early on dementia, Alzheimer's, Parkinson's, all of those, we get a lot of, oh my gosh, this is going to be a long road. I have no idea what to do. So it really is all over the place.
Gotcha. And so I know your offices are in Tysons, and you grew up in Virginia. Do you serve DC and Maryland as well?
I do. I serve clients all over the country, actually. So I have a woman who lived here. Her parents lived in Southern California and her brother lived in Seattle. And one of the things they were trying to figure out is if mom and dad should stay in Southern California or move to Seattle or move here. Like, so I can literally work with anybody around the country. I have no problem picking up the phone, talking to local resources to figure out what's there, and so that I can put an accurate plan together for these families.
Gotcha. So even if someone lives, like, we get calls a lot of time, people looking just for information because they live in, a small town in Pennsylvania or in North Carolina, and they're like, I don't even know if there's home care company here. Like, I don't even know anything. Can you work with folks like that and help do the research to help them find the available resources as well?
Yeah. So when I first talk, I tell everybody I'm an extension of senior housing and healthcare, right? And I love being able to provide solutions to families, even though if I'm not the right solution. So I'm not a placement agency. I'm not a care manager. I'm just more of I consider myself a connector, right? And the other things we do, Steve, by the way, we get a lot of calls for adult children who are just like, this is what's going on with mom and dad. They live wherever, I live wherever. I just don't even know how to start. Because the reality is people don't talk about money. And as you said earlier, a lot of times, sometimes the adult children have no idea how much their parents have. But in some cases, the adult children, they're willing to pitch in, but they can't even get through the conversation about what mom and dad need, right? So we have all kinds of people around the country calling us just for like a free chat to see if I can help them.
Okay, so and that brings me to a point. So, you have certainly a number of situations where the parents are maybe didn't save, maybe didn't have jobs where they were capable of saving for retirement, but their kids are very successful.
Yes.
How do you help? Can you help the children manage both their financial picture as well as how much money do they have to support their parents?
Yes. So we actually, as part of the family meeting, we'll have conversations about if people are going to pitch in or not, right? And I do it in a way that's very open. Like I will talk to one child individually. I won't put them on the spot. I'll talk to another child individually. We'll put them on the spot and make sure that expectations around the family are all, everybody understands where everybody else is coming from. And I'll give you an example. I had a family where mom and dad were here. Dad was declining very quickly. They needed to move, but they had been using their house like a bank. So if they moved, they really didn't have a lot of equity in their home. They had one daughter who was married with 2 kids, and they had a son who lived in New York City in a small studio apartment who was about to get married, right? So there was some really deep conversations about mom and dad, your kids don't have the funds to help you. So we need to figure out how to get you moved in a way that you're not completely depleting everything, which means you're going to have to compromise some of the things that you want, right? So sometimes it's a hard conversation. Another conversation was, I had a couple, the husband was in rehab. The wife knew that she needed to move. She didn't have the money, but her brother owned his own business in Colorado. He got pulled into the conversation. So he actually paid the entrance fee for his sister to move into the community because she could afford the monthly fee. So we are open to whatever it is the family is willing to discuss.
All right. And so do you wear armor when you talk to these people? Because I mean, these are not easy conversations, and fireworks abound.
Yeah, yeah. I tell everybody, I have a social worker heart. My mother was a social worker at St. Elizabeth's Hospital for 26 years. And I also say, after working in the industry for 15 years with dementia and hospice, especially, I'm used to having the tough conversations. I also tell everybody I'm an adult daughter, and I have no problem talking to other adult daughters and adult sons and kind of saying like, eh, I heard you, but this is not about you. This is about mom and dad, right? So yes, Steve, sometimes it gets a little tight, but other times it's just very touching. And when we get on the other side of this and these families come out and they're like, oh my gosh, like they feel more comforted, they feel heard. I love helping families.
Great. So we have a couple minutes left. I want to make sure we open it up to anyone that has a question that they didn't put in the chat. Any questions anyone has? Because otherwise I'll keep talking and asking questions myself, but I want to leave room for you all.
We usually like to wrap up too with something that you've learned from today. So if either you, Ellen, Cynthia, Ann, if you'd like to mention something that you're going to walk away with, that's always a great thing for us to know. Help your, pop yourself off mute, Ellen, and go for it.
So this is really helpful. I used to work with ALS patients, and I did know I had a family that had used Tom West, and she always recommended Tom West as a financial advisor.
Oh, awesome.
Yeah. So I'm really glad to meet you, and to have sort of this putting Tom West back in my
line of sight. Yeah.
Yeah. So, but what I find myself thinking about is I have lost both of my parents, and of the 4 children, 3 of us are single.
Yep.
And all in different situations. And I keep thinking, so I don't know that any of them have a good plan and what they're going to do. And the youngest of us has 2 children, one just starting college in the fall and the other just starting law school in the fall. And so, and I would say her health is not great.
Yeah.
So, and her income is not great now. She's
yeah.
So I keep thinking, I don't know that I have any legal responsibility for them, but I feel certainly definitely an emotional and a moral responsibility.
Right.
Is that something that?
Yeah, no, I think that's great. And you're bringing up the sibling dynamic, which a lot of people don't talk about. It's very important to respect the sibling dynamic, because sometimes your family member is not going to tell you what they're scared of or what they're concerned about, and they may not want to talk to you about their money at all, right? So this is a perfect example where you as a sibling could be like, you know what, I sat on this podcast and I think if it's not me or whoever else you may know, you know what, I think maybe there's a third party person that I think you might benefit just chatting with, because your kids are going off to college, and, then get yourself out of it. That's all you can do, Ellen, is give the handout. The other topic that you brought up is what we call the solo ager, right? When as you get older and you are single, whether you're widowed, never married, your children live across the country, don't have children, whatever, that is a space that a lot of us in this industry really want to support, because the more we can help you think through the next 5, 10, 15, 20 years, the less likely you're going to find yourself in an emergency situation, right? So all solo agers, I say, please reach out to someone in the industry and just start talking about what your plan's going to be. And I'm glad you brought up Tom West as well. So just for clarification, Tom West is one partner at SEIA, which is the wealth management firm that I work for. And Tom has worked in the senior housing and healthcare industry adjacent for over 30 years now, right? So he's the one that I knew as the finance guy who kind of got it, which is why he brought me in 5 years ago, because he was the one that's like, Arvette, the financial industry is missing this. Like, we're not serving this population of people that are going through healthcare and housing decisions, right? we need to figure out how to better help those families, which is why we built the Life Care Affordability Plan and why I joined.
Wow, excellent.
Yeah.
Right. Well, I'm mindful of the time. We're spot on at 10 o'clock. So Arvette, again, thanks for joining us. This was super helpful, very educational. You clearly know a lot of stuff, which is that people need to know. And so again, thanks for joining us. And Patricia, thanks for organizing our What's Your Plan for this month. So again, I'm Steve Lorberbaum, Assisting Hands Home Care. If you need some financial planning, and everybody needs this, give Arvette a call. If you need home care, and hopefully you don't need us, but if you do, we're here for you. Thank you very much for joining. Have a great weekend, everybody.
Bye-bye. Thank you.
Thank you, Arvette.